we're sure you're making at least 5 of these mistakes. And if you correct them, you'll be able to maximize all the valuable qualities of this amazing drink. Watch until the very end. The final reveal will amaze you. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like and let's get started. Mistake 1. Ignoring lemon zest. Are you losing important nutrients? Many people make the mistake of throwing away lemon zest when making lemon water and miss the opportunity to greatly enrich their diet. Lemon peel is a veritable treasure trove of nutrients and antioxidants that can significantly improve your health. Studies show that lemon peel contains up to 5 to 10 times more vitamin C than the juice of the lemon itself, and about 10% of the total antioxidant content, including flavonoids and polyphenol, which have strong anti-inflammatory properties. The antioxidants found in lemon zest help protect the body's cells from free radical damage, which helps reduce the risk of chronic diseases such as cancer and cardiovascular disease. Specifically, one study published in the Journal of Agricultural and Food Chemistry showed that lemon peel antioxidants can reduce oxidative cell damage by 15–20% with regular consumption. In addition, lemon peels are high in pectin, a soluble fiber that helps regulate blood sugar levels, improve digestive system function, and maintain healthy gut flora. Studies show that regular consumption of pectin can reduce the risk of diabetes and obesity by helping the body process glucose more efficiently. Lemon peel is also rich in minerals such as calcium, potassium, and magnesium, which are important for maintaining healthy bones and muscles. Including lemon peel in your diet can help strengthen bone tissue and reduce the risk of osteoporosis. To get all of these health benefits, all you need to do is grate some lemon peel and add it to lemon water or use it in cooking. However, it is important to remember to prepare the lemon properly. Washing the fruit thoroughly will help you avoid ingesting pesticides and contaminants that can have a negative impact on your health. Thus, don't ignore lemon zest, as it is an easy way to significantly increase the benefits of lemon water and support your health by adding powerful antioxidants and important nutrients to your diet. Mistake 2. Drinking lemon water before a meal. Could it be bad for your stomach? Drinking lemon water on an empty stomach may be beneficial for some people, but cause discomfort for others, especially those who suffer from acid reflux, gastritis, or other gastrointestinal disorders. The citric acid found in lemons can irritate the gastric mucosa, especially in people who are sensitive to acids. Research published in the Journal of Clinical Gastroenterology shows that citric acid can cause symptoms to worsen in people with acid reflux, causing symptoms such as heartburn, a sour taste in the mouth, and burning in the esophageal area. Approximately 20–30% of people with reflux may experience worsening symptoms when sour drinks are consumed on an empty stomach. In addition, citric acid can increase the secretion of gastric juice, which can cause irritation in people with gastritis or stomach ulcers. Studies also show that in some people, citric water can cause increased acidity in the stomach, which increases the risk of inflammation. However, in people with normal acidity, lemon water may not cause any problems and may even help improve digestion by stimulating enzyme and bile production. For those who are sensitive to acidity or uncomfortable drinking lemon water before a meal, an alternative may be to drink the beverage after a meal. In one study published in Digestive Diseases and Sciences, it was shown that drinking lemon water after a meal may help stimulate digestive enzyme production and improve the breakdown of fats and carbohydrates, which may promote more efficient digestion. An important aspect is the individual approach. For people with sensitive stomachs, it is recommended to dilute lemon juice with more water to reduce its acidity. For example, the juice of half a lemon per 250 milliliters of water can reduce irritation of the gastric mucosa. It is also useful to observe the body's reaction and, in case of discomfort, adjust the time of drinking lemon water. Thus, drinking lemon water before meals may be beneficial for some people, but is not suitable for everyone. Learn it is important to consider your individual reaction, and if necessary, adjust the timing and concentration of the drink to avoid negative effects on the stomach and digestion. Mistake 3. Using lemons from unpeeled sources. Are you exposing yourself to risks? Using lemons purchased from unpeeled or uncertified sources can carry potential health risks. Lemons, like other fruits with peels, can be covered in pesticide residues, dirt, germs, and even mold. Pesticides are widely used in agriculture to protect plants from pests, but traces of them can remain on the surface of lemons, posing a risk to consumers. Research published in Environmental Research shows that more than 30% of all lemons entering markets may contain pesticide residue on the peel. This is especially true for lemons imported from countries with less stringent pesticide regulations. Some studies also reveal the presence of hazardous chemical compounds that can have negative health effects with long-term exposure, including endocrine disruption, reduced immune defense, and increased risk of chronic disease. In addition to pesticides, lemon peels can harbor pathogens such as Escherichia coli, Salmonella, and other bacteria that can cause gastrointestinal disorders. According to the Centers for Disease Control and Prevention, CDC, inadequate handling of fruits and vegetables, including lemons, is responsible for about 48 million cases of foodborne infections in the U.S. each year. To reduce the risk of consuming contaminated lemons, it is critical to wash the fruit thoroughly before use. Regular running water may not always be sufficient to remove stubborn contaminants and pesticides. We recommend using specialized fruit detergents or soaking lemons in a 1.3 solution of vinegar and water for a few minutes before rinsing. This helps remove up to 80% of pesticide residue, according to a study conducted by the Journal of Food Science. You should also prefer organic lemons, which are grown without the use of synthetic pesticides and chemical fertilizers. Organic fruits typically contain fewer harmful chemicals and may contain 25% more antioxidants, which can help improve overall health, according to the British Journal of Nutrition. Proper storage of lemons also plays an important role in maintaining their quality. Lemons should be stored in a cool, dry place to avoid excess moisture, which can promote mold and other microorganisms. Storing them in airtight containers or in the refrigerator can extend the freshness of lemons by several weeks. Thus, using lemons from unpeeled sources can put you at risk of exposure to pesticides and pathogens. Implementing hygienic practices such as washing fruit thoroughly and choosing organic produce will help protect your health and make lemon water safe and healthy to drink. Mistake 4. Adding lemon juice too early in the cooking process. Are you losing important nutrients? Adding lemon juice too early in the cooking process can result in a significant loss of nutrients, especially vitamin C and antioxidants. Vitamin C, or ascorbic acid, is one of the most temperature-sensitive vitamins. Research published in the Journal of Nutritional Science shows that when exposed to high temperatures, above 70 C, vitamin C begins to break down, losing up to 50% of its activity after just 10 minutes of heat treatment. This means that adding lemon juice at the beginning of cooking can deprive the dish of this important antioxidant. Besides vitamin C, other bioactive compounds in lemon, such as flavonoids, which have anti-inflammatory and antioxidant properties, can also be destroyed by exposure to high temperatures. For example, flavonoids such as hesperidin and diosmin, which are beneficial for heart and vascular health, lose their effectiveness with prolonged heating according to data reported in Food Chemistry. Therefore, to preserve these important nutrients, experts recommend adding lemon juice at the end of the cooking process, when the temperature has already dropped. This preserves the freshness and integrity of the vitamins and antioxidants, ensuring maximum health benefits. In addition, adding lemon juice at the end of cooking gives the dish a bright and refreshing taste, which improves its aromatic qualities. This is especially important for dishes such as sauces, soups, and fish, where the freshness and flavor of lemon can greatly enhance the overall flavor palette. For example, in Mediterranean cuisine, lemon juice is often added in the last minutes of cooking to preserve its intense flavor and nutritional value. Including fresh lemon juice at this point also helps boost iron absorption from plant foods, making it a useful addition to iron-rich dishes such as spinach or lentils. Thus, if you want to get the most out of lemon juice, add it at the very end of cooking. Not only will this preserve its vitamins and antioxidants, but it will also provide a fresh taste and flavor to your dishes. This approach will not only improve the flavor of your food, but also its nutritional value, which will have a positive impact on your health in the long run. Mistake 5. Storing lemons in a bowl on the table. Are you doing it wrong? Storing lemons in a bowl on your desk may seem convenient and even aesthetically pleasing, but it's far from the most effective way to preserve their freshness and nutritional value. Lemons, like other citrus fruits, are quite sensitive to their environment, and improper storage can cause them to spoil quickly. At room temperature, lemons begin to lose moisture, which can cause them to dry out, lose flavor, and reduce vitamin content. According to research published in the Journal of Agricultural and Food Chemistry, when lemons are stored at room temperature, they can lose up to 30% of their moisture content in just 1 week. This causes the peel to become wrinkled and hard, and the flesh to become less juicy and flavorful. Also, if stored in the air for long periods of time, lemons can be exposed to microorganisms and mold, especially if they have even the slightest damage on the rind. Storing lemons in the refrigerator helps to extend their shelf life considerably. At about 39 degrees South, which is the standard temperature for most home refrigerators, lemons can retain their freshness for up to 4 weeks. The refrigerator slows moisture loss and prevents mold growth, making it an ideal place to store citrus. However, simply putting lemons in the refrigerator is not enough. To prevent excessive drying out and maintain optimal humidity, it is recommended to store them in an airtight container or plastic bag. This helps create a barrier to air and maintains the right level of moisture inside the package. Studies show that lemons stored in airtight bags retain up to 80% more moisture compared to those stored open. It's also important to avoid excessive moisture when storing lemons. If lemons remain wet for too long, for example, after washing, it can promote mold development and rotting. Therefore, if you plan to wash your lemons before storing them, make sure they are completely dry before placing them in the refrigerator. Thus, proper storage of lemons involves not only using the refrigerator, but also maintaining conditions that prevent moisture loss and exposure to air. Store lemons in airtight containers or bags and you can enjoy their freshness and nutritional benefits for much longer. Following these simple guidelines will help you avoid lemons from spoiling and maximize their health benefits. Mistake 6. Leaving cut lemons out in the air. Are you losing flavor and nutrients? Leaving cut lemons out in the air is a mistake many people make without even realizing that it results in a significant loss of flavor and nutrients. When a lemon is cut, its pulp is exposed to oxygen, which triggers oxidation processes. These processes destroy the vitamins and antioxidants that make lemon healthy. In particular, vitamin C, one of lemon's key antioxidants, is extremely sensitive to oxidation. Research published in the Journal of Food Science shows that a cut lemon loses up to 25% of its vitamin C content just hours after it is exposed to air. This loss is even greater if the lemon is stored at room temperature and not protected from oxygen and light. In addition, oxidation also affects the flavor of lemon, making it more bitter and less refreshing. The destruction of organic acids and aromatic compounds, such as limonene, leads to a weakening of the bright citrus flavor that makes lemon water and other dishes so fragrant. Thus, a cut lemon loses not only its healthful properties, but also much of its culinary potential. To prevent this loss, cut lemons should be immediately placed in an airtight container and stored in the refrigerator. This will help slow oxidation processes and preserve both vitamins and flavor. Studies show that proper storage in airtight containers can reduce vitamin C loss by up to 10% in the first 24 hours, significantly extending the shelf life of the product. It's also important to use cut lemon as soon as possible as, even when stored in the fridge, its nutritional value will gradually diminish. A simple and effective tip is to slice the lemon just before use to maximize its freshness and nutrients. Thus, to avoid losing the health benefits and flavor of a cut lemon, you should properly store it in the refrigerator and use it as soon as possible. These simple practices will help you keep lemons fresh, flavorful, and nutritious, which will improve both the taste of your food and your health. Mistake 7: Incomplete juicing. Are you losing some of the benefits? Incomplete juicing of lemons is a missed opportunity to maximize the nutrients and health benefits. Lemons contain not only vitamin C, but also a variety of other beneficial compounds such as flavonoids, essential oils, and organic acids that can help boost the immune system, improve digestion, and fight inflammation. However, if the juice is not fully squeezed, much of these compounds remain inside the fruit. Research conducted by the Journal of Agricultural and Food Chemistry found that the lemon cells that contain the juice are scattered throughout the pulp and located closer to the inside of the rind. This means that with insufficient force, much of the juice and the nutrients it contains can be missed. Full squeezing can increase the amount of vitamin C you get by 20–30%, as well as release more antioxidants and organic acids. Using techniques to maximize juice extraction from the lemon, such as rolling the lemon on a hard surface before cutting, can help break down the fibers and facilitate juice release. In one study, Food Science and Technology found that rolling a lemon increased the amount of juice extracted by 10–15%. In addition, briefly heating a lemon in a microwave oven for 15–20 seconds can make the cell wall softer, which also facilitates juice extraction. This method can increase the amount of juice produced by 20% compared to regular juicing. Using a lemon juicer is also one of the most effective ways to extract the maximum amount of juice. Juicers provide even pressure that helps extract not only the juice, but also the essential oils from the peel, which contain powerful antioxidants and give the drink a richer flavor. It's important to remember that lemon juice, besides being a source of vitamin C, is also rich in citric acid, which helps improve the absorption of minerals like calcium and iron from other foods. Full juice extraction will help you maximize these benefits for bone and circulatory health. So proper lemon juice squeezing techniques not only increase the amount of juice, but also help you get the most of the nutrients and enjoy a richer flavor. Learn incorporating these techniques into your daily lemon water practice ensures that you get the full benefit of this simple but powerful beverage. Mistake 8. Consuming too much lemon juice for acid reflux. Aren't you harming your stomach? Consuming lemon juice in large quantities can be a problem for people with acid reflux or gastroesophageal reflux disease, GERD. The citric acid in lemons can increase the acidity of gastric juice, leading to irritation of the esophageal mucosa and worsening symptoms such as heartburn, burning in the chest, discomfort, and even chest pain. A study published in the World Journal of Gastroenterology found that more than 30% of patients diagnosed with GERD experience an exacerbation of symptoms when consuming acidic foods, including lemons and citrus juices. Citric acid lowers the pH in the stomach, which can increase the aggressive effects of stomach acid on the esophageal mucosa, especially if the lower esophageal sphincter is weakened and cannot effectively prevent acid from entering the esophagus. For those who suffer from acid reflux, it is important to limit the amount of lemon juice consumed and closely monitor the body's response. One way to reduce the effects of citric acid is to dilute the juice with more water. For example, adding half a lemon to 250-300 milliliters of water can reduce the acidity of the drink, making it gentler on the digestive system. This can help people with GERD or acid sensitivity avoid exacerbating symptoms. In addition, studies show that the timing of lemon water intake also matters. Drinking lemon juice immediately after a meal can reduce the impact of acid on the esophagus, as the food can act as a barrier to prevent it from backing up into the esophagus. At the same time, drinking lemon water on an empty stomach can exacerbate symptoms because the acid interacts with an empty stomach where there is no food to neutralize it. It is equally important to consult your doctor before incorporating lemon water into your diet if you have chronic digestive issues. Your doctor can help determine the optimal amount and frequency of lemon juice consumption depending on your condition. Some patients may find that only a small amount of lemon juice per day works for them, while others may need to eliminate it completely from their diet to avoid irritation. In summary, lemon water can be a healthy and refreshing beverage, but for people with acid reflux, it requires extra caution. Moderation, dilution, and attention to the body's reaction will help avoid negative effects and keep the gastrointestinal tract healthy. Mistake 9. Using purchased lemon juice. Are you losing fresh nutrients? Purchased lemon juice may seem like a convenient substitute for fresh lemons at first glance, but its nutritional benefits are significantly inferior to fresh juice. Most commercial lemon juices are pasteurized and otherwise processed, resulting in a significant loss of vitamins and antioxidants. Research published in the Journal of Food Science has shown that heat treatment destroys up to 40 to 50% of vitamin C, and this process continues even after packaging. In addition, purchased lemon juices often contain additives such as preservatives, citric acid, and sugar. These additives not only reduce the naturalness of the product, but can also negatively affect its beneficial properties. For example, large amounts of sugar or syrup can increase the caloric content of a beverage, which takes away from its health benefits and can lead to undesirable consequences for people watching their blood sugar levels. One study published in the European Journal of Clinical Nutrition showed that added sugar in drinks can increase the risk of metabolic disease and weight gain. It's also worth considering that many manufacturers use lemon juice concentrates that are further diluted with water before packaging. This significantly reduces the nutrient density of the juice compared to freshly squeezed lemon juice. Concentrates typically go through several processing steps, which also affects their quality. According to data published in Food Chemistry, the concentration of beneficial flavonoids and polyphenol in juices from concentrates can be reduced by 20–30%. Using fresh lemon juice ensures that you are getting the maximum amount of vitamin C, antioxidants, and other bioactive compounds that help strengthen the immune system, improve digestion, and maintain healthy skin. Fresh juice also retains the lemon's natural essential oils, which give it a richer and brighter flavor. Learn enhancing the flavor of lemon water. In addition, fresh lemon juice can be used without concerns about artificial additives or preservatives, making it a healthier choice. This is especially important for those who follow diets that focus on keeping food clean and natural. Thus, store-bought lemon juice cannot compare to fresh lemons in terms of flavor or nutritional benefits. To maximize the health benefits, it is important to choose fresh lemons and squeeze the juice just before consumption. Not only will this approach provide you with more vitamins and antioxidants, but it will also give you a cleaner and richer flavor of lemon water, making it even more beneficial and enjoyable in your daily diet. Mistake 10. Drinking pure lemon juice. Aren't you damaging your teeth? Drinking pure lemon juice can have unpredictable consequences for your dental health and overall oral health. Lemon juice is an acid that has a low pH, around 2.0, making it comparable to some strong chemical acids. With frequent exposure to such acids, tooth enamel, the protective layer that coats the teeth and shields them from decay, begins to break down, which can lead to increased tooth sensitivity, loss of enamel luster, and the development of dental erosion. Research published in the Journal of Dentistry found that acidic beverages, such as lemon juice, can significantly accelerate enamel erosion. Studies have found that drinking acidic beverages daily can increase the risk of tooth erosion by 30–50%, depending on the acid concentration and frequency of consumption. Even if drinking lemon juice does not cause immediate pain or discomfort, prolonged exposure can cause permanent damage to tooth enamel, requiring dental intervention. In addition, the citric acid found in lemon juice promotes an environment in which bacteria can more easily thrive. The acidity lowers the pH of the mouth, which promotes the growth of cavity-causing bacteria and reduces the protective properties of saliva. It can also contribute to the formation of plaque and tartar. For those who don't want to give up the benefits of lemon juice but still care about dental health, it is recommended to dilute it with water, which helps to reduce the acidity. This reduces the aggressive effect of citric acid on the enamel and makes the drink safer for teeth. According to the recommendations of dentists, the optimal ratio is the juice of half a lemon per 250–300 milliliters of water. It is also useful to drink lemon water through a tube to minimize the contact of acid with the teeth. After drinking lemon water, it is important to rinse your mouth thoroughly with clean water to neutralize the acid and restore the pH balance in your mouth. However, brushing your teeth immediately after drinking lemon juice is not recommended, as the enamel becomes more vulnerable and brushing at this time can increase its wear and tear. Instead, it is recommended to wait at least 30 minutes before brushing to give the enamel time to recover. It is also worth considering that lemon juice can irritate the gastric mucosa, especially in people with acid sensitivity or gastritis. Undiluted lemon juice can increase inflammation and cause stomach discomfort. Diluting the juice with water reduces this and makes the drink more palatable and safer for the digestive system. So, while pure lemon juice has many health benefits, its high acidity can have a negative impact on the teeth and gastric mucosa. Diluting the juice with water and proper oral care will help protect your teeth from erosion while maintaining all the benefits of this beverage. Mistake 11. Drinking lemon water that is too cold. Aren't you harming your digestion? Drinking lemon water that is too cold may not be as harmless as it seems at first glance. While cold water is refreshing and can be a welcome drink in hot weather, it can have an undesirable effect on the digestive process. Studies show that cold water can cause blood vessels in the stomach to constrict and slow down peristalsis, the processes that are responsible for moving food through the digestive tract. The Journal of Physiology and Pharmacology published data that confirms that drinking cold water can slow down the activity of enzymes involved in breaking down food. Digestive enzymes work most efficiently at body temperature, and lower water temperatures can slow their action. As a result, food can stay in the stomach longer, which can lead to a feeling of heaviness and slower digestion of nutrients. Cold water can also affect fat absorption. One study in the European Journal of Clinical Nutrition found that cold drinks can cause a short-term slowing of fat metabolism, which reduces the efficiency of fat breakdown and digestion. This can be particularly noticeable when eating high-fat meals, when the body needs more energy to process them. For people with sensitive digestive systems, drinking cold water can also trigger stomach cramps or discomfort. According to the Journal of Gastroenterology and Hepatology, drinking drinks that are too cold can cause the stomach's blood vessels to constrict sharply and slow down blood flow, which can cause digestion to malfunction. For those who suffer from sensitive teeth, cold water can cause discomfort or even pain. People with tooth sensitivity may have damaged or thinned enamel, making their teeth more vulnerable to temperature changes. An alternative is to drink room temperature lemon water or slightly warm water. This helps maintain normal levels of digestive enzyme activity and does not cause vasoconstriction. Warm water can also help detoxify the body more quickly and effectively. In Chinese and Ayurvedic medicine, warm water is considered more beneficial to digestive health because it promotes better digestion and boosts metabolism. Experimenting with different temperatures of lemon water can help you determine what works best for your body. Water temperatures can vary depending on the time of year, health conditions, and individual preferences. Incorporating room temperature lemon water or slightly warm water into your daily regimen can create a gentler and more enjoyable experience, improving not only digestion, but also overall body health. So while cold water can be refreshing, it can slow digestion and cause discomfort. Drinking room temperature or warm lemon water can be more beneficial to the body, helping to maintain normal digestive processes and keeping both the stomach and teeth comfortable. Mistake 12. Washing lemons before use. Are you putting your health at risk? Not washing lemons before use can greatly increase your risk of ingesting harmful substances such as pesticides, germs, and dirt. Even if you don't consume the rind of a lemon directly, these contaminants can easily get onto the pulp and juice while squeezing it, making thorough lemon peeling a must practice to maintain your health. Lemons, like many other fruits, are grown using pesticides to protect them from insects and disease. According to data published by Environmental Health Perspectives, about 70% of commercially grown lemons may contain pesticide residue on the peel. These chemicals can pose health risks, especially if consumed regularly. Long-term exposure to pesticides has been linked to an increased risk of diseases such as cancer, hormone disruption, and nervous system problems. In addition to pesticides, pathogens such as Escherichia coli, Salmonella, and Listeria may be present on the surface of lemons. According to the U.S. Centers for Disease Control and Prevention, CDC, contaminated fruits and vegetables are one of the leading causes of food poisoning. Bacteria can get on the surface of lemons during transportation, storage, and contact with other contaminated produce. Unpeeled lemons that are squeezed directly into water or added to dishes can be a source of infections. To minimize these risks, experts recommend washing lemons thoroughly before use. Rinsing under running water alone may not be enough to remove pesticide residue and bacteria. The Journal of Food Science advises using a vegetable brush to remove more stubborn contaminants. Additionally, soaking lemons in a 1.3 solution of vinegar and water for a few minutes can help remove up to 98% of pesticide residue from the surface, according to research. An equally important aspect is the proper storage of lemons after washing. If lemons are stored in damp conditions, it can promote the development of mold and fungus, which can also be hazardous to health. After washing, lemons should be thoroughly dried and placed in a clean container or bag to prevent moisture buildup and keep them fresh. Thus, washing lemons before use is not just an extra precaution, but an important hygiene practice that helps protect your body from harmful substances and infections. This simple step can significantly reduce risks and ensure that your lemon water is not only refreshing, but also safe. Mistake 13. Drinking lemon water during a long fast. Can it be harmful to your stomach? Drinking lemon water during a long fast can have both positive and negative effects on your body, especially on your stomach. For some people, it can be a helpful way to stimulate digestion, but for others, it can provoke discomfort. The citric acid in lemon can irritate the mucous membrane of the stomach, especially if the stomach is empty. When you drink lemon water on an empty stomach, the acidity of the lemon juice interacts directly with the gastric mucosa. Although the stomach naturally produces acid to digest food, overexposure to outside acids can be a problem for people with gastritis, ulcers, or hyperacidity. Research published in the Journal of Clinical Gastroenterology found that drinking acidic beverages such as lemon water can exacerbate symptoms in patients with gastroesophageal reflux disease, GERD, or chronic gastritis, causing heartburn, burning, and discomfort in the upper abdomen. In addition, prolonged fasting itself can weaken the protective functions of gastric mucus, making the stomach more vulnerable to the effects of acids. One study in the American Journal of Gastroenterology found that fasting for more than 12 hours can increase the stomach's sensitivity to irritants such as acid and spices. In such cases, drinking lemon water can aggravate the situation, causing painful symptoms such as gastric cramps and increased gas. For those who feel uncomfortable drinking lemon water on an empty stomach, it is recommended to try drinking it after a meal. Research published in the Digestive Health Journal has shown that drinking lemon water after a meal can help improve digestion by stimulating bile production and improving the breakdown of fats. This is especially true for those who suffer from slow digestion or discomfort after meals. Lemon water can act as a gentle cleanser, helping to keep the digestive system functioning properly. However, for some people, especially those practicing interval fasting, drinking lemon water on an empty stomach can be perfectly acceptable and even beneficial, helping to energize digestive processes. Studies have shown that lemon water can stimulate the production of digestive enzymes and help the body detoxify more effectively. But it's important to remember that the body's reaction to acid is individualized, and what's good for one person may be problematic for another. So, drinking lemon water during a long fast can have both positive and negative effects on your body. It is important to monitor your body's reaction and adjust the timing and amount you consume depending on your needs and stomach sensitivity. If you are experiencing discomfort, drinking lemon water after a meal can be a safe and healthy alternative, supporting your stomach health and overall well-being. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos. Do you love coffee? But did you know that consuming it incorrectly can turn into serious problems for you? In this video, we will discuss 10 fatal mistakes that can destroy your health and send you to the hospital if you keep making them. We are sure that many of you are already making these mistakes, and if you watch to the end, you will learn how to correct them and enjoy your coffee without dangerous consequences. This video will be extremely informative and helpful. So, if you want to become a master of your health, click like, and let's get started. Mistake 1. Overconsumption of caffeine is one of the most serious mistakes a person can make without realizing the potential consequences. Caffeine is a powerful central nervous system stimulant, and excessive consumption can lead to catastrophic health consequences, including arrhythmias, cardiac arrest, seizures, and even death. One of the most prominent examples is the case of a 24-year-old man from the UK who took a lethal dose of caffeine in an attempt to boost his energy before an important event. He drank 6 cans of energy drinks and several cups of strong coffee over the course of several hours. As a result, his heart stopped beating and he died on the spot. The case was scrutinized by medical experts who concluded that the caffeine overdose had caused him atrial fibrillation, a life-threatening heart rhythm disorder. No less terrible is the case of a girl from the United States who drank several cups of coffee in an attempt to stay awake before an exam. A few hours later, she began to have severe seizures caused by a caffeine overdose. Doctors determined that her body had been overloaded with caffeine, resulting in electrolyte imbalances and an overactive nervous system. Despite emergency medical attention, her condition remained critical for several days, until her body was able to cope with the effects of the overdose. Scientific studies confirm that consuming more than 400 milligrams of caffeine per day can cause serious heart problems, especially in people who are already predisposed to cardiovascular disease. Caffeine can increase adrenaline levels in the blood, which leads to vasoconstriction and an increase in heart rate. This puts dangerous strain on the heart and can trigger a heart attack or stroke, even in young and healthy people. Many people don't realize that caffeine is not only found in coffee, but also in many other foods. Energy drinks, black and green tea, chocolate, and some medications such as painkillers and weight loss drugs. Thus, a person can easily exceed the safe dose without even realizing it. In one study published in the journal Mayo Clinic Proceedings, doctors examined the effects of caffeine on a group of patients with cardiovascular disease. They found that patients who regularly consumed more than 400 milligrams of caffeine per day had twice the risk of arrhythmias and hypertension than those who limited their caffeine intake. Thank you. In addition to cardiovascular problems, caffeine overdose can cause seizures, which is a result of its stimulating effects on the brain. In cases of severe overdose, the seizures can be so intense that the person loses consciousness and control of their body. This can lead to dangerous situations such as falls, head injuries, and even coma. It is important to note that even if a person does not drink a lethal dose of caffeine at one time, regular consumption of large doses can cause serious health damage. The gradual accumulation of caffeine in the body leads to chronic fatigue, irritability, insomnia, and anxiety disorders. As a result, a person gets into a vicious circle, trying to overcome fatigue with new doses of caffeine, which only exacerbates the problem. Mistake 2. Mixing coffee with energy drinks or stimulants is one of the most dangerous combinations that can lead to serious health consequences. Energy drinks and stimulants such as guarana, taurine, or ephedrine contain high doses of caffeine and other substances that enhance its effects. When these products are mixed with coffee, caffeine levels in the body increase many times over, posing a real risk of overdose. An example is the case of a 19-year-old athlete from the UK who drank several cans of energy drink and then added several more cups of coffee before a competition. As a result, he experienced tachycardia and a sharp rise in blood pressure, leading to hospitalization with a diagnosis of acute heart failure. Doctors detected high levels of caffeine in his blood, which turned out to be lethal. Fortunately, the young man was saved, but this case was an example of how easily a dangerous line can be crossed. A study published in the Journal of the American College of Cardiology shows that combining coffee with energy drinks increases the likelihood of hypertension and acute arrhythmias by 40% compared to pure caffeine consumption. This becomes especially dangerous for people with hypertension and latent cardiovascular disease. Additionally, a 2018 study by scientists from the University of South Australia found that the combination of coffee and energy drinks dramatically increases the risk of seizures. They found that this explosive cocktail activates receptors in the central nervous system, causing nervous overexcitement and even epileptic seizures in some people. For example, a case in the U.S., where a 23-year-old student began suffering from uncontrollable seizures due to regular consumption of coffee and energy drinks, resulting in nerve tissue damage and serious health problems. Cases like this emphasize the importance of a conscious approach to stimulant consumption. Many people think that the combination of coffee and energy drinks will give energy and vigor, but in practice, it leads to disastrous consequences. Mistake 3. Ignoring contraindications in cardiovascular disease. This is one of the most dangerous mistakes that can be made when drinking coffee. For people with chronic heart disease, such as hypertension, coronary heart disease, or arrhythmia, coffee can become a real threat to life. The fact is that the caffeine in coffee actively stimulates the cardiovascular system, increasing heart rate and blood pressure. Combined with pre-existing heart problems, this can be a trigger for myocardial infarction, stroke, or other acute cardiac events. Research published in the journal Circulation found that in people with cardiovascular disease, consuming more than 200 milligrams of caffeine a day, about 2 cups of coffee, can increase the risk of heart complications by 30%. One striking case involved a 56-year-old woman from the U.S. who suffered from hypertension. She drank up to 5 cups of coffee a day, despite doctors' warnings. One day, during a busy day at work, she felt a sharp pain in her chest and lost consciousness. The doctors diagnosed a myocardial infarction, which developed against the background of high blood pressure and caffeine overdose. Another study conducted by scientists from Harvard University showed that people with arrhythmia, the risk of heart attacks increases significantly with regular coffee consumption. The study analyzed 500 people with chronic cardiovascular disease and found that frequent caffeine consumption increases the likelihood of stroke by 20%. For example, a 65-year-old man from Canada who suffered from arrhythmia was hospitalized after drinking several cups of strong espresso, which caused him to have a stroke. In addition, in 2020, the American Journal of Cardiology published an article analyzing data on the effects of coffee on blood pressure. As a result, it was found that in patients with already high blood pressure, even 1 cup of coffee can cause a jump in pressure by 10-15 millimeters of mercury column, which increases the risk of hypertensive crisis. In one such case, a 60-year-old man already suffering from hypertension was on the verge of life and death, when, after several cups of coffee, he suffered a hypertensive crisis that nearly led to a stroke. It is important to realize that cardiovascular diseases require careful attitude to your health. Coffee, being a powerful stimulant, can be a trigger for severe complications. If you have heart problems, you should always consult your doctor before consuming beverages containing caffeine and should be taken in moderation. Mistake 4. Drinking coffee that is too hot is not just a habit, but a serious health risk that many people underestimate. Drinking coffee at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit, significantly increases the risk of esophageal cancer and other cancers of the digestive system. This threat has been confirmed by numerous studies that have shown a direct link between drinking very hot beverages and damage to esophageal tissue, which over time can lead to malignant neoplasms. In 2016, the International Agency for Research on Cancer, IARC, a division of the World Health Organization, listed drinking drinks that are too hot as a possible carcinogen. This decision was based on an analysis of more than 1,000 studies that demonstrated that regularly drinking beverages at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit, significantly increases the risk of esophageal cancer. In a study conducted in Iran where tea is traditionally drunk at very high temperatures, it was found that people who regularly drink very hot beverages have a 90% increased risk of esophageal cancer. One real-life case was documented in Turkey, where a 45-year-old man who was used to drinking coffee at about 70 degrees Celsius, 158 degrees Fahrenheit, began having trouble swallowing after a few years. After an examination, doctors diagnosed him with esophageal cancer, which developed due to years of exposure to hot beverages on the esophageal mucosa. This case caused a public outcry and prompted the medical community to actively discuss the effects of hot drinks on digestive health. Also worth mentioning is a study published in the journal Lancet Oncology which analyzed the habits of more than 50,000 people from South American countries where hot drinks are popular. The study found that the risk of developing esophageal cancer was significantly higher in those who drank coffee or yerba mate at temperatures above 65 degrees Celsius, 149 degrees Fahrenheit. Scientists note that constant exposure of the esophageal mucosa to high temperatures causes chronic microtrauma, which over time can lead to cell mutations and tumor formation. It is important to note that the problem does not only affect coffee, but also other hot beverages such as tea or hot chocolate. However, coffee, as one of the most popular drinks in the world, is often consumed by people on the go when they do not have time to cool it down to a safe temperature. Many people, especially those with busy schedules, prefer to drink their coffee immediately after it is brewed without waiting for it to cool down. This may seem like a minor detail, but the consequences can be serious. To prevent the risk, it is recommended that you always let the drink cool down to no more than 60 degrees Celsius, 140 degrees Fahrenheit, before you start drinking it. It may take a few minutes, but this time can greatly reduce the likelihood of developing dangerous diseases in the future. Mistake 5. Drinking coffee when you have a peptic ulcer or gastritis is an extremely dangerous practice that can lead to serious and sometimes fatal consequences. Coffee, having acidic properties and stimulating the production of stomach acid, can aggravate the symptoms of gastritis and peptic ulcer disease by increasing the irritation of the mucous membrane of the stomach and duodenum. When a person with peptic ulcer disease or gastritis continues to consume coffee, especially on an empty stomach, it can exacerbate the disease. In particular, coffee stimulates the production of hydrochloric acid, which increases the acidity of gastric juice and provokes further irritation and damage to gastric tissue. In severe cases, this can lead to ulcer perforation, a dangerous condition in which the stomach or intestinal wall ruptures, causing acute peritonitis. If the perforation is not diagnosed and treated immediately with surgery, it can be fatal. According to research published in the journal Gastroenterology, about 20% of people with peptic ulcers who continue to consume coffee experience a recurrence of the disease. In one case, described in the medical journal Case Reports in Gastroenterology, a man in his 50s with chronic gastritis repeatedly ignored doctors' recommendations and continued to drink several cups of coffee a day. As a result, he developed an acute exacerbation of his gastritis, which developed into an ulcer with subsequent perforation. This led to the need for emergency surgery and hospitalization in the intensive care unit. Doctors noted that his condition was directly related to prolonged coffee consumption against the background of gastritis. An equally important factor is that coffee can reduce the effectiveness of drugs that are prescribed to treat ulcers and gastritis, such as proton pump inhibitors. These drugs are designed to reduce the level of acidity in the stomach, but coffee, increasing the production of acid, can level their effect, which complicates treatment and lengthens the recovery period. Coffee can also aggravate the symptoms of reflux esophagitis, which often accompanies gastritis and peptic ulcers. Reflux occurs when stomach contents back up into the esophagus, causing a burning sensation, heartburn. The caffeine in coffee relaxes the lower esophageal sphincter, which allows acid and food to enter the esophagus, increasing the burning and pain. The risk of internal bleeding during an ulcer exacerbation is another major threat associated with coffee consumption. A study published in the Journal of Internal Medicine found that peptic ulcer patients who regularly consumed coffee had a 2.5 times higher risk of developing internal bleeding than those who gave up the beverage. Internal bleeding can manifest as vomiting blood or black tarry stools, both of which require immediate medical attention. Thus, people with peptic ulcer disease or gastritis should avoid drinking coffee, especially during periods of exacerbation. The health condition requires a cautious attitude towards food and drink, and unfortunately, coffee can be a catalyst for serious complications. Mistake 6. Consuming coffee during pregnancy in large doses is a serious mistake a mom-to-be can make, which can ultimately jeopardize both her health and the life of the fetus. Caffeine penetrates the placental barrier and directly affects the developing baby's body. Its effects can be especially dangerous in high doses when a pregnant woman's metabolism of caffeine slows down, leading to a buildup of the substance. According to a study published in the American Journal of Obstetrics and Gynecology, regular consumption of more than 200 milligrams of caffeine per day, that's about 2 cups of coffee, is associated with an increased risk of miscarriage and preterm labor. One large study from Denmark found that women who consumed more than 4 cups of coffee daily were 37% more likely to miscarry compared to those who avoided caffeine during pregnancy. The main problem is that the fetus's body cannot process caffeine efficiently because its liver and kidneys are still in the developmental stage. This causes caffeine to circulate in the fetus's blood much longer than in the mother's blood, which can cause cell damage, stunted growth, and problems with nervous system development. Moreover, caffeine affects the blood vessels of the placenta, which can impair blood flow and access to nutrients. A study published in the Journal of Maternal Fetal and Neonatal Medicine found that women who consumed more than 300 milligrams of caffeine per day had an increased risk of having a low birth weight baby. This condition can significantly increase the likelihood of various health problems in newborns, including immune system disorders and difficulty with thermoregulation. A real-life example may seem shocking, but it demonstrates how important it is to consider the amount of caffeine consumed. In 2018, a case was described in the UK where a woman who was used to regular coffee consumption continued to drink 4 to 5 cups a day during her pregnancy. Unfortunately, her baby was born prematurely with a number of complications related to underweight and developmental delays. Doctors noted that caffeine played a key role in the complications, making it difficult for the fetus to develop normally. In addition, studies show that high doses of caffeine can increase the risk of preeclampsia, a dangerous condition that is accompanied by high blood pressure and swelling. Consuming more than 300 milligrams of caffeine per day has also been linked to the development of gestational diabetes in some women, leading to additional pregnancy complications. Among other things, caffeine can negatively affect a pregnant woman's sleep quality, and lack of sleep and constant fatigue can exacerbate pregnancy complications and cause mental health issues. Studies show that chronic sleep deficiency in pregnant women can lead to depression and increased anxiety, which in turn affects the overall health of the mother and child. Thus, pregnant women are advised to strictly limit their caffeine intake, or eliminate it completely from their diet to minimize the risk to themselves and the unborn child. Mistake 7. Abuse of coffee in glaucoma is a mistake that can seriously affect vision and aggravate the course of the disease. Glaucoma is a chronic disease characterized by increased intraocular pressure and can lead to vision loss if left unchecked. The caffeine in coffee can increase this pressure, making it dangerous for people with glaucoma. Studies conducted by scientists from Harvard Medical School have shown that caffeine consumption in doses exceeding 200 milligrams per day, that's about 2 cups of coffee, can increase intraocular pressure by 3 millimeters of mercury column within an hour of consumption. For a healthy person, this may not be critical, but for people with glaucoma, even such a small increase can accelerate the progression of the disease and affect vision. Coffee abuse is especially dangerous in the case of open-angle glaucoma, which is often asymptomatic in its early stages. Patients may not notice vision changes until damage to the optic nerve becomes severe. High intraocular pressure caused by caffeine can imperceptibly deteriorate the nerve and contribute to loss of peripheral vision. There's an interesting case study described in a medical journal. A 58-year-old man suffering from glaucoma was unaware of the effects of coffee on his vision and regularly drank 4 to 5 cups of coffee a day. Despite following medical advice and taking medication to control intraocular pressure, his condition worsened. After further investigations, it was found that his coffee habit was the main cause of his intraocular pressure spikes. Only after significantly reducing his coffee consumption did his condition stabilize and his vision loss slowed down. Another study published in the journal Investigative Ophthalmology and Visual Science showed that regular coffee consumption increases the risk of glaucoma in those who have a predisposition to this disease. Scientists analyzed data from more than 100,000 people and found that those who drank more than 3 cups of coffee a day had a 66% increased risk of developing glaucoma compared to those who drank no or moderate amounts of coffee. The same study found that coffee can negatively affect ocular blood flow by reducing oxygen and nutrients to the optic nerve, increasing its degeneration. This effect is particularly pronounced in people over the age of 50, whose risk of developing glaucoma is already high. It is important to remember that glaucoma is a disease that requires constant monitoring and care. Even minor lifestyle changes, such as coffee abuse, can have a negative impact on vision. Therefore, people suffering from this disease are advised to minimize coffee consumption or give it up completely to reduce the risk of complications. Thus, moderate coffee consumption is an important aspect of eye health care for glaucoma patients. Mistake 8. Regularly drinking coffee on an empty stomach is one of the most common mistakes many coffee drinkers make. While this flavorful beverage is often thought of as a way to perk up in the morning, consuming it on an empty stomach can lead to serious gastrointestinal health consequences. Caffeine stimulates the production of stomach acid, which without food can have an aggressive effect on the gastric mucosa. When coffee enters the stomach on an empty stomach, it causes cells to produce more acid than necessary. This excess acid begins to erode the gastric mucosa, which normally protects the tissues from irritation. Studies have shown that regular consumption of coffee without food can cause gastritis, an inflammation of the mucous membrane of the stomach, which, if left untreated, can develop into an ulcer. A real-life case study published in the journal Gastroenterology is interesting. A 35-year-old woman, an office worker for several years, started the day with a cup of strong black coffee without breakfast. After a while, she began experiencing intermittent abdominal pain that worsened with each passing month. Her symptoms included heartburn, nausea, and upper abdominal pain. She eventually developed a stomach ulcer, which required treatment with acid-reducing drugs and a strict diet. Research also supports this risk. A paper published in the Journal of Clinical Gastroenterology found that people who regularly drink coffee on an empty stomach have a 30% increased risk of developing gastritis and peptic ulcers compared to those who drink coffee after meals. Scientists believe this effect is due to increased acidity as well as the effects of caffeine and other active ingredients in coffee on stomach cells. In addition, a study conducted at the University of Southern California showed that regular consumption of coffee without food increases the risk of developing acid reflux, GERD. This syndrome occurs when stomach acid backs up into the esophagus, causing burning and inflammation. In the long term, this can lead to the development of chronic inflammation and even precancerous conditions in the lower esophagus. A case described in the medical literature concerns a man of 45 years of age who began each day with 3 cups of coffee on an empty stomach. After several years of this habit, he developed severe gastritis and had to undergo an operation to remove the part of his stomach affected by erosions and ulcers. This case emphasizes that the abuse of coffee on an empty stomach can have fatal consequences. Moreover, coffee without food can have negative effects on the nervous system. People who drink coffee on an empty stomach are more likely to complain of anxiety, nervousness, and even tremors. Notes this is because caffeine without food is absorbed more quickly into the bloodstream, causing a sharp increase in adrenaline and cortisol levels, stress hormones. This can lead to nervous disorders such as anxiety and panic attacks, especially in caffeine-sensitive people. Thus, regularly consuming coffee on an empty stomach poses serious health risks, especially for those who are already prone to stomach problems. The best way to minimize these risks is to consume coffee only after meals to protect the gastric mucosa and prevent serious complications. Mistake 9. Consuming coffee for chronic insomnia is one of those fatal mistakes that can slowly destroy a person's nervous system and mental health. Caffeine is a powerful stimulant that affects the central nervous system, increasing alertness and activity levels. Please, however, for people who suffer from chronic insomnia, this effect can be devastating, causing serious neurological and mental health problems. When a person suffering from insomnia continues to consume coffee, they are caught in a vicious cycle. Caffeine causes arousal, which prevents normal sleep, and lack of sleep leads to an even greater desire to consume coffee to maintain energy. A study published in the Journal of Sleep Research found that regular coffee consumption in people with insomnia increases the risk of developing anxiety disorders by 30% and depression by 25%. Over time, constant stimulation of the nervous system leads to its exhaustion. One real-life case was described in the American Journal of Psychiatry. A young woman of 32 worked in a law firm and consumed up to 6 cups of coffee daily to cope with sleep deprivation due to chronic insomnia. For several years, she experienced nervous exhaustion, but continued to consume coffee despite clear signs that her mental health was deteriorating. Eventually, her anxiety disorders developed into severe depression that required hospitalization. Doctors note that excessive caffeine consumption exacerbated her condition and led to a nervous breakdown. Insomnia not only impairs cognitive functions such as attention, memory, and decision-making, but also affects a person's emotional state. Research conducted at Stanford University shows that people with chronic insomnia who continue to consume coffee are 40% more likely to experience symptoms of depression and 20% more likely to experience suicidal thoughts compared to those who give up caffeine. In addition to neurological effects, regular coffee consumption for insomnia can lead to physiological problems. Inadequate sleep disrupts the regulation of cortisol, the stress hormone, which leads to chronic fatigue and exhaustion. This, in turn, causes the body to seek additional sources of energy, provoking further coffee consumption and worsening the state of the nervous system. Researchers from Harvard University have found that people who regularly consume coffee in conditions of chronic insomnia are at greater risk of developing cardiovascular disease. Lack of sleep and constant nervous system arousal increase blood pressure and cortisol levels, which significantly increases the risk of heart attacks and strokes. Long-term consequences can include hypertension, heart failure, and other serious heart abnormalities. In real life, there are often stories of excessive coffee consumption leading to emotional exhaustion and depressive states. One such case is described in the clinical report of a British psychiatrist. A patient suffering from chronic insomnia experienced constant panic and anxiety attacks despite regular therapy. When she was found to be a heavy daily coffee drinker, caffeine withdrawal became a key element of her treatment. After 3 months without coffee, her condition improved significantly, her anxiety decreased, and her insomnia became less severe. Thus, drinking coffee for chronic insomnia can be a dangerous mistake that not only worsens insomnia but also has a devastating effect on the nervous system, increasing the risk of depression, anxiety disorders, and even suicidal tendencies. Mistake 10. Combining coffee and alcohol is a hidden danger that is often underestimated. Many people believe that having a cup of strong coffee after drinking alcohol helps with alcohol intoxication, but this is a dangerous misconception. Instead of reducing the effects of alcohol, coffee only masks the symptoms, making the situation even more risky. Caffeine and alcohol act differently on the body. Caffeine is a stimulant that increases central nervous system activity, increases heart rate, and raises blood pressure. Alcohol, on the other hand, acts as a depressant, relaxing muscles, and slowing brain function. When these two substances mix, the body receives conflicting signals, which can cause a number of negative effects. A 2016 study by scientists at Brown University found that coffee can mask the effects of alcohol intoxication, making a person feel more awake than they actually are. This creates the illusion of sobriety, which often leads to dangerous decisions such as drunk driving or continuing to drink alcohol until intoxication sets in. Statistics show that up to 50% of accidents involving drunk drivers are precisely because of the false sense of sobriety induced by caffeinated beverages. In addition, regular mixing of coffee and alcohol causes a serious blow to the liver. Alcohol itself is already a toxin to the liver, and its constant consumption can lead to the development of diseases such as fatty liver degeneration, hepatitis, and even cirrhosis. Caffeine, while not toxic to the liver in moderate amounts, when combined with alcohol can increase the burden on this organ, impairing its regenerative abilities. Researchers from Harvard Medical School found that people who regularly mix coffee and alcohol have a 30% increased risk of developing liver disease compared to those who avoid the combination. One illustrative case is the story of a 28-year-old man from the U.S. who was hospitalized with acute alcohol intoxication after a party where he mixed alcohol with energy drinks containing caffeine. Doctors noted that the caffeine not only masked his intoxicated state but also worsened his liver condition, requiring multiple days of hospital treatment. Another major concern is the effect on the cardiovascular system. The combination of coffee and alcohol can lead to sudden spikes in arrhythmias. This is because coffee stimulates the heart, while alcohol, on the other hand, slows down its rhythm. These opposite effects can cause heart rhythm disturbances and lead to life-threatening conditions such as ventricular fibrillation or cardiac arrest. One study published in the Journal of the American College of Cardiology found that people who regularly consumed coffee and alcohol together had a 20% increased risk of heart attack. Regularly combining coffee and alcohol can also trigger mental disorders such as anxiety, depression, and nervousness. Caffeine increases anxiety symptoms. And alcohol, in turn, disrupts the chemical balance of the brain by suppressing the production of serotonin. This leads to emotional instability and can contribute to the development of chronic mental health disorders. In 2017, the Mayo Clinic described the story of a patient suffering from chronic anxiety and depression who regularly mixed alcohol with caffeine-containing beverages. Her condition worsened significantly, requiring long-term treatment with psychotropic drugs. Thus, combining coffee and alcohol is a dangerous mistake that can lead to a host of negative health consequences, including liver damage, heart problems, and stroke, and mental health problems. So, now that you've learned about the 10 fatal mistakes of drinking coffee, the question becomes, how do you drink coffee safely? It's all about moderation and the right approach. First, try to limit your coffee intake to 400 milligrams of caffeine per day. That's about 4 cups of regular coffee. If you have chronic conditions such as hypertension, glaucoma, or stomach problems, it's best to consult your doctor to determine your safe dose. Secondly, choose the right time for coffee. It is ideal to drink the first cup an hour after waking up, and the last cup at least 6 hours before bedtime to avoid insomnia and overstimulation of the nervous system. Also, do not drink coffee on an empty stomach. It can irritate the gastric mucosa. It is better to drink it after breakfast or as a pleasant addition to lunch. do not forget that the quality of coffee also matters. Give preference to fresh beans, avoid excessive amounts of sugar, artificial additives, and energy drinks. Remember that coffee can be your friend if you consume it wisely. Enjoy every cup, but don't let coffee jeopardize your health. What do you think about this? Do you agree with these statements? If there are any questions, ask them in the comments. More information on this topic can be found at the links in the description below this video and on our channel. Subscribe and hit the bell for all notifications. Please like and share this video with your friends. Thanks to our sponsors for their support. I eagerly await your comments and encourage you to watch these useful videos. Maintaining kidney health is crucial for overall well-being. These hard-working organs clean our blood, balance fluids and electrolytes, and produce essential hormones. But, in our busy lives and unhealthy lifestyles, we often forget to take care of them, which can damage them or lead to their diseases. But don't worry. You can heal your kidneys and improve your health just by eating some foods. Yes, that's true. Diet plays a crucial role in maintaining optimal kidney health, and what you eat can either stress or help your kidneys. In this video, we will share 8 essential foods that are packed with nutrients, which can help you in healing your kidneys. So, let's begin. Number 1. Bitter melon. Bitter melon is an edible fruit that is cultivated worldwide for its unique benefits. It is highly valued in traditional medicine, particularly in Asia, Africa, and South America, for its numerous health benefits, including potential improvements in kidney health. It contains antioxidants including vitamin C, vitamin A, zeaxanthin, and lutein. These antioxidants help combat oxidative stress throughout your body, including in the kidneys. Oxidative stress is basically an imbalance between free radicals and antioxidants in the body, leading to cell and tissue damage. It can cause scarring in glomeruli, the cleaning units of kidneys, damaged kidneys, and can be a major contributor to various kidney diseases. So, by combating oxidative damage, bitter melons can help you heal your kidneys and maintain their healthy function. Bitter melon can also help kidneys by regulating blood sugar levels. This is due to its compounds like cheratin, lysine, and peptide P. These compounds can improve the utilization of sugar in your tissues and increase the secretion of insulin, a hormone responsible for regulating blood sugar levels. High blood sugar levels can damage the blood vessels in the kidneys over time and lead to diabetic nephropathy, a form of kidney damage. By helping to manage blood sugar, bitter melon can protect your kidneys from diabetes-related damage. Many studies also have confirmed bitter melon's role in regulating blood sugar levels. In fact, a study involving 40 people showed that consuming 2,000 mg of bitter melon every day for 4 weeks regulated blood sugar levels efficiently. Bitter melon also possesses anti-inflammatory properties, which can be beneficial in reducing kidney inflammation and slowing the progression of certain kidney diseases. Because chronic kidney disease and other kidney-related ailments often involve inflammation, so, by managing inflammation, bitter melon can prevent and treat kidney damage. Moreover, a study also found that bitter melon has a preventive effect against kidney damage caused by methotrexate, a medicine used to treat different diseases. But, that's not all. Bitter melon can also help you lower bad cholesterol, LDL levels, a risk factor for kidney diseases while increasing good cholesterol. When it comes to how to incorporate bitter melon into your diet, you can eat it both raw and cooked, or you can also opt for bitter melon powder capsules. However, raw melon can be bitter and difficult to eat, so prefer other methods. Moreover, remember that while bitter melon offers numerous benefits for kidney health, use it with caution, because consuming bitter melon in excessive amounts can lead to adverse effects due to its potent bioactive compounds. Number 2. Flax seeds. These tiny seeds are loaded with many beneficial nutrients, which make them an excellent choice for you to support kidney health. Firstly, they contain omega-3 fatty acids, especially a type called alpha-linolenic acid, ALA. These fatty acids help reduce inflammation and can heal your kidneys. Secondly, flax seeds contain fiber and lignans. These two nutrients along with fatty acids can contribute to improved heart health and can lower bad cholesterol. Both of these benefits are closely linked to kidney health because a healthy heart and lowered bad cholesterol can ensure healthy blood vessels and proper blood flow to the kidneys. Moreover, flax seeds can lower blood pressure, a significant benefit because high blood pressure can exacerbate kidney issues, as it can affect the blood supply to your kidneys, affect their efficiency, and damage them. Adding flax seeds to your diet is easy and delicious. Sprinkle them on your cereal, blend them into smoothies, or mix them into yogurt. If you enjoy baking, add ground flax seeds to bread, muffins, or cookies for a health boost and a pleasant nutty flavor. Eat 1 to 2 tablespoons. 7 to 14 grams of ground flax seed per day. It appears to be a reasonable and safe dosage to support kidney health. However, it's important to introduce flax seeds gradually into your diet due to their high fiber content, because it can cause digestive discomfort. Moreover, do not consume flax seeds with other high-fiber foods like bran or psyllium husk, as this can also lead to digestive issues such as bloating and gas. You should also keep in mind that excessive intake of flax seeds alongside blood-thinning medications or supplements like aspirin or warfarin can increase the risk of bleeding due to their omega-3 content, which has blood-thinning properties. Number 3. Turmeric. Turmeric is a yellow spice widely used not only to enhance the flavor of food, but also for its health benefits. The primary compound responsible for these benefits is curcumin, which gives turmeric its distinct color. Curcumin has antioxidant properties, particularly beneficial for maintaining kidney health because it can help combat inflammation and neutralize free radicals, providing significant protection to your kidneys. Studies also indicate that curcumin can support the health of blood vessels by reducing inflammation and oxidative damage in them. Healthy blood vessels are essential for regulating blood pressure and preventing blood clots, both of which are vital for kidney health. Moreover, curcumin can also reduce the amount of protein in the urine, a common indicator of kidney disease, thus contributing to better kidney function. Incorporating turmeric into your diet is simple and can make meals more flavorful. Add it to smoothies, soups, and curries. You can also create a delicious drink, known as golden milk, by mixing turmeric with milk, dairy, or plant-based, and a bit of black pepper, which enhances the absorption of curcumin. For general kidney health, opt for 500 to 1,000 milligrams of turmeric per day. This equates to about 50 to 200 milligrams of curcumin per day. For those with chronic kidney disease, the dosage should be on the lower end, around 500 to 1,000 milligrams of turmeric per day, 50 to 100 milligrams of curcumin. Higher doses may potentially worsen kidney damage. Moreover, while turmeric is highly beneficial, it can be a bit problematic when combined with certain foods or medications. For example, combining turmeric with blood-thinning foods like garlic, ginger, and ginkgo biloba can increase the risk of bleeding. Similarly, Pairing turmeric with high oxalate foods like spinach and beet greens can raise the risk of kidney stones in susceptible individuals. Number 4. Fish. Fish is an excellent source of high-quality protein. This protein can help in tissue repair throughout your body, including kidneys, and can support overall kidney health. So, when you eat fish, you're not just enjoying a tasty meal, but also supplying your kidneys with essential building blocks for optimal performance. Moreover, certain types of fish, such as salmon and mackerel, are rich in omega-3 fatty acids. These fatty acids act as a defense against inflammation, a major factor contributing to kidney damage over time. These omega-3s can also enhance blood flow, ensuring your kidneys can efficiently filter waste and perform their crucial functions. Moreover, another advantage of fish is its naturally low content of saturated fats. This makes it a heart-healthy choice that can indirectly benefit your kidneys. Eat 2 to 3 servings of oily fish like salmon, mackerel, or sardines per week for improved kidney health. However, it's important to be aware of harmful food combinations with fish. For example, combining fish with foods high in oxalates, like spinach and beets, may increase the risk of kidney stones in susceptible individuals. Number 5. Olive oil. Olive oil is packed with antioxidants like vitamin E and polyphenol. These antioxidants, like other ones, can reduce oxidative stress and inflammation, which are major factors in kidney damage. They can also protect your kidneys from further damage. Olive oil also has monounsaturated fats, which can reduce bad cholesterol and lower high blood pressure and can contribute to healthy kidney functioning. Moreover, it is also phosphorus-free and is a kidney-friendly food. When it comes to how much olive oil you should consume, it depends on your individual calorie needs and dietary restrictions. A general recommendation is to use olive oil in place of other fats, limiting total fat intake to 25 to 35% of daily calories. However, it is important to be mindful of combining olive oil with foods high in sodium or processed sugars, as this can counteract its health benefits and potentially harm the kidneys. High sodium intake can elevate blood pressure, while excessive sugar can lead to diabetes, both of which negatively impact kidney health. Number 6. Blueberries. Blueberries are small fruits, but their benefits go far beyond their size. They are packed with antioxidants, especially anthocyanins, which give them their distinctive deep blue color. As mentioned before, antioxidants play a crucial role in combating oxidative stress and inflammation, both of which are leading causes of kidney damage. They also contain vitamin K, which can promote heart health and help in improving kidney health. This is because a healthy heart ensures smooth blood flow throughout the body, including the kidneys. This efficient circulation can help the kidneys filter out waste and harmful substances more effectively. Moreover, blueberries are also low in sodium, phosphorus, and potassium. A half cup of blueberries contains less than 150 milligrams of potassium. This makes them a kidney-friendly diet, as these minerals will not stress your kidneys. Moreover, an 8-day study involving obese people at risk of heart issues found that consuming 2 ounces 50 grams of frozen dried blueberries reduced their BP by 4 to 6%. This reduction in BP is also good for the kidney, as high BP can damage kidneys and nephrons and is a risk factor for kidneys. Another remarkable benefit of blueberries is their potential to prevent urinary tract infections, UTIs. UTIs can lead to serious kidney infections if left untreated. The special compounds called proanthocyanidin in blueberries may prevent bacteria from adhering to the walls of the bladder, reducing the risk of UTIs. This is particularly beneficial for individuals with kidney issues as it lowers the likelihood of additional complications. So, aim for 1 to 2 servings of fruit per day as part of a kidney-friendly diet. While blueberries are generally safe and beneficial, do not combine them with certain foods. For instance, mixing blueberries with dairy products like milk can sometimes reduce the effectiveness of the antioxidants in blueberries. Number 7. Cabbage. Cabbage is a green leafy vegetable enjoyed in many cuisines around the world. It's not only delicious, but also beneficial for health, particularly for kidney health. It is loaded with antioxidants like vitamin C and sulforaphane. These antioxidants combat oxidative stress and reduce inflammation throughout your body, including the kidneys. This can heal damaged kidneys and even protect them from further damage. Cabbage is also rich in fiber, which can aid in digestion and help your kidneys remove excess waste and fluids. Moreover, cabbage is low in potassium, and this makes it a kidney-friendly diet, because impaired kidneys may struggle to remove excess potassium and become stressed. Moreover, potassium levels may exceed in the blood and cause many other health issues. So, cabbage is an excellent choice because it contains low levels of potassium. There are many easy and tasty ways to incorporate cabbage into your diet. It can be eaten raw in salads and slaws, fermented to make sauerkraut or kimchi, or cooked in soups, stews, and stir-fries. These various preparations make it simple to enjoy cabbage's health benefits regularly. To fulfill the recommended dosage, eat about half a cup of cabbage 5 days a week. However, be mindful of certain food combinations that can be harmful. Cabbage, when combined with high-sodium foods like processed meats or canned soups, can lead to increased blood pressure and negatively impact kidney health. So, pair cabbage with fresh, whole foods to maximize its health benefits. Number 8. Cucumbers. Cucumbers are very nutritious fruits, and they can help you in healing your kidneys in different ways. Firstly, they are naturally very high in water and have diuretic properties. This keeps your kidneys hydrated and increases urination. Increased urination can help your kidneys flush and remove excess fluid and waste buildup from the body, and will improve kidney functioning. Secondly, they are packed with antioxidants, including vitamin C and beta-carotene. These antioxidants can combat harmful free radicals, causing damage and act as protectors for your kidneys. They can also reduce inflammation naturally. As discussed before, oxidative stress and inflammation are often risk factors for kidneys, so by managing them, cucumber can help in healing your kidneys. Thirdly, cucumbers are very low in sodium, which is excellent for healing your kidneys and maintaining their health. This is because low sodium will not stress out your kidneys and it will lower your blood pressure. Blood pressure is a major risk factor for kidneys because it can damage blood vessels, reduce blood supply to kidneys, and damage nephrons, the filtering units of kidneys. Moreover, cucumbers have potassium, which can also help in regulating blood pressure. In this way, cucumber can help in improving kidney health. Cucumbers also have alkalizing properties and can help maintain the right pH in your body, which is vital for your kidneys to function effectively. Moreover, cucumbers are low in phosphorus and potassium, which makes them a kidney-friendly diet as these minerals will not stress your kidneys. You can eat them without concern. When it comes to how to incorporate cucumbers into your diet, add them to salads, enjoy them as a snack, or infuse them in water for a refreshing drink. Aim for at least one serving of a medium cucumber per day as part of a balanced diet. However, do not consume too many cucumbers along with high potassium foods like bananas or avocados, because it can lead to an imbalance in mineral levels, which could be problematic for those with kidney issues. If you like this video, give us a thumbs up and share it with everyone you care about. Thanks for watching and see you in the next